Hi everyone, we're just going to wait for a couple more minutes for more people to join us and then we'll start shortly. Thanks for your patience. All right, good morning everybody. So thank you so much for joining us this morning with Project Vietnam. We're going to be doing a very brief overview of what public health communications is. And shortly after, at the end, I'll be talking about some opportunities you can do to volunteer with us, or become an intern, or get more experience in public health and/or communications. So I'm going to start sharing my screen. See if I can share my screen. Okay, there we go. Alrighty. So, well, what is public health communications? Right now, COVID-19 is going on and there's a lot of misinformation. And it can be really overwhelming in terms of, where to find accurate information and how to talk about information correctly and accurately, because really people's lives are at stakes. So, obviously we start off with our favorite friend, Google. And if you type in COVID-19, you'll get a whole list of queries. Now, Google is a really great aggregate of what's going on, but I would say this is a very important time to be conscious about, where your source of information is coming from. So for instance, you click on news and you're going to see a whole array of news postings, and it can get pretty overwhelming. So I'm going to just start off with some of what I recommend. For those who aren't familiar with who I am, my name is Nam Nguyen Lê. I am the Director of Public Health Programs and Media Manager at Project Vietnam Foundation. Probably should have started with that. I did my undergrad degree at UC Berkeley in public health, and then I continued onwards to complete my MPH at Johns Hopkins University. So these are my recommendations based on my background. So COVID-19, for the California Public Health website is a really great tool in terms of understanding aggregate deaths and cases within California. Obviously, Project Vietnam conducts a lot of projects outside of California, but for all intents and purposes, we are focusing on California because we're pretty domestic this year because we can't travel. But here, give a sense of total cases, total deaths, and how many tests are reported. Now, this is actually a really important number because obviously there's still an ongoing issue of who can get a test, where can you get a test. So I would say we tend to be underreporting, but it is still really important to see where the trend is going. So you can go by county information, testing, industry guideline. So that is this is where I go to for state information with COVID. And it's a lot of very helpful tabs up top. The CDC is my federal to go. So federal being state, or not state, basically what's happening on a national level. And it's a really great tool. Just, they've really laid out everything in terms of information, communication resources as well. So they have all this information that you can really go, like a digital press kit, social media toolkit, which I'll go here, the social media toolkit, where they, have these pre-made infographics and messages that you can post on your own social media pages, as well as, as well as, what's going on with that there within the CDC. So the CDC, I also want to just let people know, the CDC is a surveillance branch of the federal government. They collected data from states and hospitals, and then they just simply report what's going on a national level. So my last favorite website and source of information is the Johns Hopkins website. It is a COVID resource center. It is looking at COVID at a state, federal, and global perspective. So here you can see global cases confirmed, global deaths, and then it is also comparing how many cases in the United States and how many deaths in the United States. And you can look at the global and the US map as well. They provide updated tracking and also really good sources of information. Let's see, assuming it will load. Okay, great. So this is a global map. This is all mapped in live time. You can look and compare where COVID cases are, where and what COVID cases are really spiking around the world. You can also look in this left-hand corner. So unfortunately, the United States is the #1 in terms of COVID cases, followed by Brazil, India, Russia, and South Africa. So my internet is acting a little up, but it's a really, oh, here we go. It's a really sobering visualization of what is going on. I really like this website. It visualizes everything. It's all live time in terms of, what's going on in the world. So it helps put things into perspective. You can zoom in. You can really, really zoom in. Again, this isn't perfect. It's based on reported cases, but it provides a very good overview of what's going on. This is still global cases. Okay, great. And this is same, still from Hopkins, a visualization of what's going on in the United States. So again, you can just see like, you know, top 20 counties, by number of deaths, Queens, New York, confirmed cases by county, Los Angeles, which is number 1, which is what we're right next to. So here we go. And the last website I really want to say is an excellent source. I know people like to go to New York Times, the Washington Post, Vox. I actually really, really like Stat News. Stat News is an entire online newspaper, news website dedicated specifically to anything related to STEM, so science, technology, engineering, medicine. And they have really, really good, they were the first publication to cover COVID when it was emerging in Wuhan, China. And they have really good, op-eds and coverings, or, news coverings of what's going on with COVID. So they even have a dedicated coronavirus. So 7 months later, and, they're often written by journalists who specialize in public health communications, medicine, and anything related to just STEM journalism. So for instance, like, will COVID vaccines be safe for children? So I'm going to start here, and I'm going to just click on this article. So, read this article, and there's always a lot of information going on. And this one is covering about, will vaccines be safe for children and pregnant women? We just don't know. But obviously, there is a lot of anti-vaccination sentiment, and within public health, it's our job to be communicating this information accurately. So this article provides a really good overview to a specific concern, which is valid. You don't want to be unnecessarily putting your loved ones at risk, especially for young developing adolescents. So here's where we're going to start with the implementation of public health communications. So first is looking at the sources. I've already given you 4 recommendations. The second, is really, well, how do you post it to your social media channels? So I'm going to just I'm just going to Google, Pew Research Center, social media. Pew Research Center is a 5th source that I really like. They simply report numbers again, and they, create, they'll provide a lot of overviews regarding certain information. So social media fact sheet. So I would say in public health communications, where are we right now and how do we do it? Well, honestly, social media, especially in the time of physical distancing from one another, is a great tool. As you can see from Pew Research Center, social media use is very high. As of February 2019, 72% of US adults use it. So who uses social media? And you can kind of break it down, but really everyone is using it, right? And then you can break it down here. It's like, all right, YouTube is the most popular at the moment. We won't be focusing on YouTube. That's because we're looking at infographics and text messages today. But obviously, Facebook is second most popular. Let's see, what's this one? Instagram is the 3rd. Let's see. Twitter is also popular as well, but you can really break it down. Now, there was let me see, social media and misinformation. Well, with great potential comes a lot of also potential for misinformation. So, multiple findings have shown that misinformation spreads on social media and what we can do about it, honestly, it's everywhere. There's a lot of, with this pandemic, there was a lot of misinformation going out in terms of how you can cure yourself, or are masks effective, or is this a 5G conspiracy theory? There's a lot going on. And the thing about social media, while it can also be a great way to connect with, friends and family and loved ones, near and far, so really right place for spreading information that is not true. So in public health communications, what are we supposed to do about it? We come from a training of evidence and fact-based practices, and now we have to grapple with online digital conspiracy theorists. What do we do? Well, we just have to be better at messaging. Well, how do you be better at messaging? First, you got to know find the good sources, find your news sources that are good. And I'm not talking about stuff like, published papers in like JMIR or anything. I'm talking about stuff like Stat News, something that is friendly to someone who's non-specialist. So that's why I shared the 4 sources that I like to go to earlier. Stat News is really, really good for finding anything interesting. And again, Hopkins also has like recommendations for news covering or news articles that is relevant or interesting. So that is why we have to understand the power and the misuse of social media. Okay, so I'm gonna go back to my article. I'm like, all right, this is a good article. And what I'd like to do is I'm gonna just save this image to downloads, get back to that. And now I'm going to create a message. So I'm going to skip over to a couple of tools that I like to use for social media messaging. So let's see, communications, yeah, there we go. So buffer.com is a great platform. It is really, really good for cross-posting across different social media platforms. Here you see I've set it up to our Project Vietnam Foundation page on Facebook, as well as our Twitter page, and as well as LinkedIn. Now you could connect Instagram, but I'll get back to that in a bit. So first thing I like to do is I take over my article, take the URL, copy it. Then I go to, Facebook. And then here at the very top, you can go what we like to share, and then Facebook, it automatically, Buffer is really nice because it will automatically shorten the URL. When you're posting to Facebook, you don't need to include the URL. Twitter you do, so just something to keep in mind. But again, it automatically shortens it. So, well, COVID-19 vaccines, be safe for everyone. So it shows you an article. Now I'm going to go like, okay, I want people to know what's going on. So what I like to do is to kind of go through the first few paragraphs and try to find something that stands out. Vaccines are always doesn't have to blah, blah, blah. So let me see, kind of go through it. And, Stat News is a really great source because they don't like to create these sort of clickbaity headlines, and they don't have clickbaity, points in their articles. So obviously, or like, there's no definitive idea. So what I like to go, I'm like, okay, so obviously the concern right now is schools reopening. So people who are wondering, is it, with schools opening again, there's going to be a spread of COVID. When are we going to get a vaccine? There's always a concern about, is the vaccine going to work and how safe it is? There's a lot of safety issues going on right now. So that's what I'm thinking when I'm drafting this message. I'm like, okay, so people are concerned about safety. So I'm going to go with schools reopening for the fall and an inevitable rise in COVID-19 cases resulting people literacy. Now more than ever, people want to know when a vaccine can become. However, so nice thing about Buffer is that it corrects you if you can't type correctly. So I started off with, here's a current concern, schools reopening, and is COVID cases going to come back with the flu season. People want to know when a vaccine is going to become available, so you kind of get to the point. How safe are vaccines? Vaccines, and who should we give them to? Right? Experts weigh in. So that is my copy for Facebook, which is nice. I think it's nice because I'm biased. Okay, so we start for Facebook. Facebook doesn't have a character limitation. For people who are familiar with Twitter, Twitter does. Twitter only allows you to have 280 characters. Buffer will show you right here how many characters you have left. So I do Facebook first, then, oh, perfect. So this with Twitter, again, you have to include the URL, which is shortened. Twitter also uses hashtags. Hashtags are, think of it as if for people who aren't familiar with Twitter, think of hashtags as a way for people to look for trending topics. See, COVID-19 is a trending topic. And if you want your message to be seen, by people who are looking for a certain topic, you would tag something like this. Obviously, vaccines is a topic. And you can see right here that, it's telling me how many characters I have left. That includes spaces. And so I'll just give an example. When I, kind of backspace a bit, it's like, oh, now you have 11 characters. Do enter, it's like, oh, you have 9 characters left. So just something to keep in mind with. So the last thing I want to show you, and if you want to add to Project Vietnam, to LinkedIn, you want to toggle on and off, sure, it's very helpful. Except when you need to put your link back in. So you can also publish it on LinkedIn and say, you say you want your article to show up. Handy. So that's what you can do. So a lot you can do with buffer.com. Now I'm going to show you what later.com is. So earlier I said here you can connect Instagram. I actually don't like using Buffer for Instagram because for people who are familiar with Instagram, it's a phone-based image social media platform owned by Facebook because Facebook owns everything. And on Buffer, when you connect your Instagram page through buffer.com, it is quite limiting, and you have to do a lot of it manually. So you have to go in and you have to click on your phone, and you have to post it manually. It's just not automatic, which is something I'm not a fan of. So later.com does this for you automatically. So what I'm going to do is I'm going to add an image. So earlier I showed you, or I demonstrated okay, we're going to save this image. So later.com, all you do is you drag the image that you want to use into this little bucket right here. Now, if people recall, I saved this image from, this website. So I did that. Now I'm like, okay, handy. What I'm going to do is I want to schedule this, drag it here, and I go, okay. Now what I want to do, I'm like, okay, why don't I just copy this. Now I go back and forth between if I want to include the URL. If, for an Instagram, when you have a URL in the description, it's not hyperlinked. So later.com is really nice because you can create a later.com profile and you can add your links. So for instance, Instagram project. So let's just look at this. There we go. So Project Vietnam has a LinkedIn bio, which is created by later.com. And when you click on this bio, either on your phone or on your desktop, it takes you to this page and you say, okay, learn more, click on this, take you to, whatever the URL link. So click on this, take you to this. So I personally really like later.com because of this function. So there we go. So you can create the link in bio and then you just copy. I like to copy this. I go here. Let's just say we keep the link in the bio. It's like click our bio to learn more. So just gonna keep, take out this and then do that. So that's great. So you just hit save and then automatically publish. Nice. So the other thing about Instagram too, so this will be published at 9:33. The other thing about later Instagram is that they actually have specific ratios or aspect ratios for your images. So if you ever run into a problem that your image isn't meeting the aspect ratio, later.com will alert you to have a little red box and say, oh, it's a problem, but we don't have that problem. So actually, I'll just show an example. Yeah, see, too wide for post to Instagram. So I'll let you know automatically that your image is too wide, and then you can just go into edit, update image, and then it's like, it will be automatic published. So just discard the post because we're not doing that one. So yeah, this one's scheduled. And now all you do for buffer.com, you can schedule a post, or scheduling a post, you can specify what time and what time zone. If you add the queue, you can it'll automatically put it to this next little slot. I'm just going to share it now just because it's a relevant bit of information. And there you go. So if you click on analytics and buffer, it'll show you what's been sent out, right? Now we have the free version of buffer. You can upgrade to see more information, but honestly, I think this is a very useful platform. See? And yeah, so you can also go to settings, posting schedule. If for some reason you have an issue, you can reconnect your account for some reason. So, but these are your social accounts, and it's quite handy. But the last thing I want to go over is the posting schedule. So this posting schedule is based off of different social media blogs that recommended when to post on each platform, but you can change it. It's very customizable and it's quite helpful. So, again, it's more of like looking at trying to figure out what is working on your different social media platform. And this is an analytics or this is just what has been previously posted for Twitter. So yeah, and I do want to say, so let's say like you don't want to use buffer, you don't want to use later.com, that's fine. You want to just do it on your phone, or you just want to do it directly from your desktop, that's totally fine as well. What you can do if you want to shorten your URL, so let's see, I'm going to use this one, right? But you also want to make it shortened. You just go to bit.ly.com, bit.ly, copy and paste your link, shorten it, and it'll do it automatically for you. There's other ones, there's other tools as well, but this is just one tool that I like to use because it's free. And character count as well. So let's see, I'm just going to copy this one. So character count tool tells you like how many characters you have done. So let's see. Oh, right, here we go. So it says you have 270 characters and 48 words. Great. So sometimes it's a little off, but if you're trying to construct a public health message and you really want to keep it short and succinct, especially or constrained to the social media platform limitations, this is actually a really helpful tool. Now, the big question again is like, what is effective public health communications? So my personal guideline is first, make sure you got a good source. Again, government websites, public, they're all public health, and these are my go-tos just because of like, this is our data. And then you go like, okay, so what's your source? Then who's your audience? Who are you trying to reach out to? The Public Health Vietnam, or Public Health Foundation, oh my God, Project Vietnam Foundation, in our public health program, we are really reaching out to a variety of people, but specifically our focus is on children. So with children comes the parents. So when I was constructing this message, my focus is like, okay, obviously this is a concern of parents right now. I'm fairly confident, 95% confidence interval, that most parents are not going to care that much in terms of test reporting. How many tests have been reported? I'm just going to go on a whim and say most parents don't care. Right now, most parents are thinking, what am I going to do with school? There's a lot of information going around right now. And how do I protect my children? And how do I protect myself? That's really hard. So when I was constructing this message, it's like, okay, this is a concern right now. And this is this is concern 1 and this is concern 2. So you really want to find information that is relevant to your target audience. And I'm just going to go through previous examples as well. So we had a PSA campaign that we ran for about 3 weeks in July last month. And we were just trying to get a sense of what people were really concerned about and what people cared about. So, for instance, like you can see here, this is about cloth face coverings and are masks effective? And then, picking a hashtag of like masking is caring. You can find, if you go to twitter.com, let's see, or login, or trending hashtags. You just search that really quickly in Google. You can just find trending hashtags on different platforms, but that's just an example. When I go back to buffer, so we can use different emojis like trouble breathing, like is this something alert, and different images to kind of get a sense of urgency. And we want to see, what was the most effective public health messaging. So we're finishing up a community-based manuscript. And what we really found is that images with people in them tended to be most effective in terms of people clicking and engaging with something. So I'm going to stop sharing something really quickly, and let's see. I'm going to stop sharing this window, and I'm going to go over to another window. So stop sharing this window, and then we're going to share our second window. Assuming. Perfect. Okay, great. So in analytics, you can go through and look at different things like what's working and what's not working. This is just a different Twitter page. But the first thing is always, if you're really, really concerned about what's going on, if people are really tuning in to your message, first is look at impressions. Impressions is, how many people have seen it on that platform. Engagement is if someone clicked on it, did someone like it? Did someone comment on it? Did someone, whatever, just they interacted with it. So personally, I think the most helpful metric to look at is the engagement rate. The engagement rate is, it depends on different social media platforms. Instagram and Facebook and Twitter all have different ways of calculating it, but the most consistent, pretty much every social media platform that I've really worked with, They have impressions, some kind of, either impressions or some kind of metric that looks at impressions, some kind of metric that looks at engagements, and then you can calculate engagement rate. Engagement rate tells you, like, of the people who saw your social media posting, how many people really took their time to, like, interact with it, as opposed to just scrolling, which isn't, I scroll all the time because sometimes I'm like, oh, that looks cool, and I don't really go from there. But so, for instance, you can have 1,000 people who see your message, but one person clicks on it. I would say that's probably not the most successful social media post. Even if 1,000 people saw it, only one person clicked on it. So 1,000 people seeing it, I mean, that's just an extreme case, versus only 10 people, let's just say only 10 people saw your social media post, but 2 people clicked on it. That's a much more successful social media post, because yes, only 10 people saw it at a given time, because that can change over time. But if 2 people clicked on it, that means that, like, 20, it's easily a 20% engagement rate. Again, that is an exaggeration, a very extreme case, but I just wanted to go over that briefly. Okay, so what can you do in terms of volunteering with Project Vietnam Foundation? We have a lot of opportunities going on right now in terms of public health messaging. We still need to do that based on all of the numbers and evidence. Unfortunately, there is going to likely be a second wave of COVID in the fall, especially with flu season coming back up again. And, like I mentioned earlier, there is a lot, and I mean a lot, of misinformation going on right now, in terms of that is being dispersed all over social media, especially regarding, is COVID real? Apparently is a conversation still, versus how is it transmitted? Are masks effective? And, eventually, is the vaccine going to work? There's a recent publication that said, like, you can really make a difference in terms of how your family and friends react to vaccines, depending on how it's posted and how you post and interact and talk about it on social media. So we are open to interns, volunteers who are really interested in getting any experience in public health communications. It's a very specialized field. It can be tricky too, because you're merging 2 areas that tend to not overlap all the time, unfortunately, which is evidence-based practice and, a lot of medicine and scientific backing, and really communicating that specialized language to a non-specialist population. So the trick is to find a way of finding your sources, creating a message, and making sure that message is effective. Are you communicating it well? The example I like to use is when Ebola was ongoing, and 5 years ago, the CDC director at the time, I understand his intention. He told people that we want people to be afraid. Now, it caused a lot of unnecessary panic, and people were just, in the United States, were just completely freaking out. Everyone thought they were going to get Ebola. Not particularly helpful, because the reality is that, no, given our federal response and global infrastructure at the time, unlikely. It was absolutely contained to West Africa, and we didn't have a global pandemic. So, but, even though the intent was to make people vigilant, the effect was really causing a lot of unnecessary panic and anxiety among, United States civilians who frankly didn't have a lot to worry about. Probably should have been more worried about the flu, but it's an ongoing issue within public health. So if you're interested in that sector, we're always welcoming interns. And if you're interested in more of a public health, we're always looking for public health interns as well, just in terms of looking at data and looking at community-based practices and research. And really, if you're just a communications person, you just want to be in communications, we're always looking for that as well. I am going to end this webinar. right now and just leave it with a testimonial from one of our previous interns from the summer, who also worked on some of the public health messages that you saw when I was demonstrating in Buffer. Thanks everyone, and I hope you have a great rest of your day.